Hi, this video is in our posture series, and we're going to be talking about how pain can be caused by how you're sleeping, or if you already have pain, how it can actually be made worse while you're sleeping. We're going to talk about why that could happen and what you can do about it.
Okay.
So,
starting with the why.
And starting with, I just wanted to share a personal story for me, because you have to think about your mattress, how old your mattress is. But I had a mattress that was like only a year old or so, and my body just did not like it. I started having back pain, and the reason I realized it was my mattress was because I was traveling and I didn't have back pain at the hotel. Yeah. In fact, this just happened to someone else that I was consulting with. So you have to sometimes put your detective hat on and think about your mattress, how old your mattress is. And sometimes if you think it is, you just go to sleep somewhere else in your house if that's a possibility.
Yeah. Or book a vacation.
So anyway, that's one of my tips for you today.
Okay.
So why can this happen, that the way we sleep can cause our back pain?
Right.
And that's because what we had been talking about, the similar thread, is that if we don't change positions very much, and some of us don't change that much positions while we're sleeping,
right,
and then others of us are all over the bed. But that can cause feed into it because we're just kind of stiff and not moving around very much. And then the other thing is if we're sleeping kind of at the end ranges of our positions. So like if we're sleeping all curled up into a ball, and we're sleeping, that can actually not be good. And then some people sleep with their wrists all bent in.
Yeah.
So that can actually lead into some wrist pain,
right,
neck pain. Why don't you go ahead and lay down?
Okay.
Okay, so actually that looks pretty comfortable.
I'm ready for bed.
So one thing you do want to avoid is sleeping. Go ahead and lay on. Actually, she doesn't have to do it. You want to avoid sleeping on your stomach. That has been shown to cause a lot of neck and back.
Really?
And back pain. Yeah, you don't.
I didn't know. I sleep on my stomach.
See, I'm not there to know. No, you're not supposed to be. You're not supposed to sleep on your stomach. I just got done consulting with someone who actually, that was one of the biggest problems that she was having. She already had back pain and had been seen by a chiropractor, etc. But that she was sleeping on her stomach. And how we figured out that was causing her problems is that she had her most pain. One of her high points of pain was when she got up at night to go to check on her child, because she has a 6-month-old.
Wow. And
so when we got her to stop sleeping on her stomach, it got better. It didn't go away. We still had work to do, but it got better.
Wow.
So so the other thing is that when you're sleeping on your side, go ahead and sleep on your side. And this is really true during pregnancy, postpartum, or if you're having any pain in your hips, to use a pillow in between your knees. Mm-hmm. Now, remember, we talked about not curling up a whole lot, because then you're at that end range. So, but you can sleep bent like this and having your back extended.
Right.
And that's nice. And depending on your comfort, you might even need to slip another pillow here, depending on how it feels.
Okay.
You want to have a pillow that supports your neck, but not if you don't want to sleep on 2 or 3 pillows, because you don't want your neck to be pitched up, like that. You kind of want to have your head in alignment with your spine. That is the optimal position. And if you're having problems with your neck, they do sell neck pillows. So that's just an FYI. If you are having problems with pain in your low back, sometimes people will feel better if they, and this is true during pregnancy too, postpartum, that just put a small towel roll under your flank, because that just kind of helps support so that your spine isn't like scooping down.
Yeah. I could see how this would support the belly.
Yes,
too.
Yes. And then, especially in that later part of pregnancy, you can even take something as simple as a neck support pillow and put it underneath, or put it this way. You just kind of have to fool around with it to help support the whole weight of the baby, because you don't want the weight of the baby going and pulling on your spine. And sometimes that can make a really nice difference in how comfortable you are.
Right.
Now, you don't ever want to sleep completely flat on your back during pregnancy, because even earlier on, because it's recommended, and this is by ACOG, American College of Obstetricians and Gynecologists, that you do not sleep flat on your back in the last trimester of pregnancy because it presses the circulation. So you might as well just kind of get used to not sleeping on your back, in my opinion.
Yeah.
Or exercising or anything like that in the last trimester. So that is my tips for side lying. And again, you don't want to be bending your wrists up like this. Sometimes people sleep like this because that can cause some problems with your wrists.
Yeah.
And then you want to switch sides. Some people, and that I find, they always sleep on the same side. And then that causes tightness on one side versus the other. So you do want to switch sides, and that might be a hard habit to break, but just I would recommend working on that.
Okay.
And then sleeping on your back if you are not in your last trimester of pregnancy. If you are having some problems with your back pain, it is also helpful to sleep with a small pillow underneath your knees. So just having a pillow under your knees, and that can be very comfortable also. One other tip, and then we'll be done with our tips here, is that you can, if you're sleeping coming back on your side, and you don't really want to be completely on your side, you can put a pillow behind you, and you can lay part way back.
Oh, I didn't even know this was an option.
Yeah, and then you can put pillows here, So, and that's called half on your side, rolling back. And then by the other token, you can come half forward this way with the pillow. And that's kind of comfy too.
It is.
So those are my tips for you. And we will talk to you soon.
Good night.